I was just giving a moment to everyone to log on, to grapple with the technology of it all. But a very, very warm welcome to all the participants, the speakers, the panelists, but most of all, the audience who've consistently egged me on to do this. Through the last 2 weeks, I've to everyone to log on, to grapple with the technology of it all. But I've received so many messages in the last week for asking me to do this. And I'm so excited to be, hosting this event with the August D.Y. Patil University. In fact, I have a little surprise for you, but I'm going to come to it in a moment. For now, I just want to say every panelist here is on the front line fighting the COVID pandemic, something that has flummoxed humanity all over the world, and in fact, united everyone all over the world against one common enemy. These are doctors who are generous, who are kind, who want to altruistically help humanity. I've chosen and picked doctors who actually want to share the host of their knowledge that they've come across while treating people, while endangering and risking their lives, because you know what it is like when people are curing, people who have the coronavirus. So I'm going to tell you why I started this forum, why I'm doing this panel. I found this is one of the diseases or epidemics that has so many myths and so much fear and anxiety surrounding it, that I felt that if I was to get doctors from the front line to dispel these myths, to share their knowledge, it would work to take away the fear psychosis and allow people to be positive. Don't you agree that being positive is half the battle won? So I started two huge groups of human beings intertwined with doctors who dispel myths every single day on these groups. And then I transferred this into a panel discussion. So I have with me some very special people here today. And the little surprise I have for you is I have with us also our chief guest today, who is Dr. Vijay Patil. He's the Chancellor of the D.Y. Patil University. He's very, very busy, as are all the other doctors, but we have absolutely arm twisted him to be here with us because he's created a hospital, an altruistic, a philanthropic hospital where he's helping underprivileged people. He's also part of creating the doctors who actually fight this pandemic. So I'm going to try and, arm twist him further to stay for the whole panel. But in case he can't, he's going to answer the questions that you sent to me to ask him. I also have with me my partner in this panel called Dr. Suchetan Pradhan. Dr. Suchetan Pradhan is not only a very famous doctor who's affiliated to the Harvard University, but he's also the head of dentistry, the CEO the dental clinic called Pradhan Dental Clinic, and he is an implant cosmetic dentist. A little more about Vijay Patil. Dr. Vijay Patil is not only Chancellor of D.Y. Patil University, but I know we have a lot of cricket fans here. So just a little trivia. He's the president of the Mumbai Cricket Association, and he's pioneered COVID care in his hospitals before other hospitals roped themselves in. He has 10,000 doctors and health COVID workers and warriors working for him as we speak. And I must say he's a great inspiration to them all. Dr. Kinita Patel is not only a sports nutritionist, a dietitian, a weight management specialist for celebrities like Alia Bhatt, Zahir Khan, and a lot of celebrities all over the world, but also people like me who are not film actors, but who want to look slim for the rest of their lives. She's a very, very generous person, as is Dr. Suchetan. They just take you into their fold and help you, and I'm privy to that. I also have with me Dr. Mickey Mehta. Before I tell you about his, all his great things, I want to tell you that he's going around Bombay actually giving medication to senior citizens. He's a very kind person, apart from being a global leading holistic health guru. He knows so much about the Indian Sanskriti of healing. He actually, whenever I'm taking a session, I try to motivate myself with him. He rambles off into Indian mantras from our Shastras and from our Vedas. And I'm really impressed by that. Dr. Mukesh Batra, I don't think needs an introduction. He's put homeopathy into the world map. He is the head and the founder of the Batra group of homeopathic clinics. He's also an author, but also has sent medication to our police, to our frontline workers, to the people who are actually out there on the field. He's been couriering medicines. I've been the lucky recipient, and he's going to answer some very important questions on homeopathy. Dr. Aparna Hegde, also one of the great doctors of our times. She's not only an internationally renowned uro-gynecologist, but a COVID warrior in the front line, and only manages to answer my messages at 12 and 1, because she's there in her hazmat suit, literally working with people, with the victims of COVID, with patients, and I have deep respect for her. Dr. S. Narayani runs the Fortis group of hospitals, like Aparna, Swapna, Suchetan, Kinita. These are people who are out there till 12 and 1 at night dealing with patients. She's running these hospitals. She's helping humanity from a very frightening epidemic. Dr. Anish Gupta. Dr. Anish is not only a very renowned acupuncturist, but he's the advisor to the Ayush Ministry, the national president of the Wellness Council, and he's the national president of the Acupuncture Council, but also a wellness expert advising the Harvard University. I just want to make sure that I've covered everyone. I hope I haven't left anyone out. And yours truly, very humbly, I'm Nisha Jamvwal. I'm not I'm representing the layman out there who wants to know so much about the COVID situation, feeling very badgered by what's happening. Life has come to a standstill. And just before this seminar, when we were doing a tech check, we were discussing how it's even difficult to have a single malt together these days, because there's this social distancing, which we're going to discuss right now. And I'm not going to delay you any further. I want to start with our questions. My first question is for Dr. Vijay Patil. Dr. Vijay Patil, thank you so much for being with us today. Thank you so much for taking out this time. You have run the D.Y. Patil University for so long. It is one of the best educational institutions that we know of. It's also doing so much for Bombay and for the rest of the world. People fly down to come to your hospitals. Do you feel, I just want to know, what do you feel about the COVID? I mean, after having so much experience, you were one of the pioneers who started dealing with the COVID pandemic. What have you seen in terms of the progression of how people are reacting, of how the virus is morphing and mutating? And that's something that's really frightening people, isn't it?
See, I think, first of all, thank you so much for the very generous introduction. And it's a real pleasure to be a part of this panel and share this day with so many experts from different fields.
You're our chief guest. You're our epoch today.
And I think it's a wonderful initiative, and it's great to be a part of this panel.
Thank you,
and I think essentially, we run one of the largest tertiary healthcare hospitals in the region. So we've been quite used to seeing a large number of patients walk into our facility. And I remember that when it was in the month of February, March, we were seeing all these scenes from Italy and Spain and, the United States. And we were kind of wondering that how this, how we would tackle such a pandemic if it arrives the shores of India. And essentially, I think when we entered into a lockdown, there were essentially there was a lot of fear. People were kind of, fearful of what the outcomes would be. Some were fearing, naturally for their personal health. Others were concerned about the challenges that they would face on a professional level. But I think what has emerged and what I have personally seen at the micro level, through the services of the hospital, that we're extremely resilient. And it's what makes us truly remarkable is the fact that it's at moments like these and times like this that everyone has come together. They've kind of united. Everyone has kind of collaborated. So I think that's a great quality for to see. You actually see that taking place here. Coming to the specific question as far as COVID is concerned, I think the two things that immediately came to my mind, being in charge of a hospital, was the fact that what is it that we need to do in our physical infrastructure that would cater to the needs, that this pandemic, and when you have a constant flow of patients walking into our facility. So we had to look very closely at the physical infrastructure, and more importantly, it was how we would manage our healthcare professionals. So healthcare professionals, I think, I truly believe that healthcare workers, professionals, they're truly instruments of God, because the kind of skills that they've acquired through years and years of dedication. So they've really, they kind of honed their skills, and they're able to make changes in people's lives. So the challenge, the same basic challenge that we faced, was that to get the fear out of, particularly some of our healthcare professionals, and they were quite reasonable. It was quite a natural thing for every individual to experience that. But it involved like how would they take care of their own families, how would they take care of themselves in terms of PPEs, in terms of all the equipment that was necessary so that they could deliver efficiently. I recollect my time. I'm extremely grateful to all the residents. I think they've certainly been the backbone of our hospital. So, whether it's our postgraduate students across different years. So I've seen how resilient they have been. I received a number of calls from different parents, from parents of all these resident students. They were extremely concerned about the health of their students who were pursuing post-graduation in our institution. So I had to assure them, and I had to kind of it's a very difficult thing to do, because just think of this, that we have all our children sitting in our homes, and at that point of time these residents were working almost non-stop, in 8-hour shifts, 12-hour shifts in the hospital. So the biggest challenge that we faced in terms of making sure that absenteeism was at a minimum, and that involved a lot of interaction with residents, with nursing staff, with doctors, with all the ward boys, right across the line. So I think that, to my mind, was the biggest challenge that we faced while facing this particular COVID crisis.
And Vijay, sorry to bring you back, but I wanted to ask you specifically that what have you learned about the coronavirus that has confounded experts worldwide? You've been dealing with the patients, doctors, you've been dealing at a macro level. What have you found about the virus that has, made it one of the most enigmatic things at the moment?
See, I think obviously what all experts say is that the way the infection rate spreads. So that's obviously one thing that's pretty much evident across all the cases that you see around the world. Yeah. But I think the positive aspect is, like, I can speak about our hospital and the clinical results that we've achieved in our hospital, is that it's not something that one obviously needs to be careful about it, but one need not fear it, because you've seen such good clinical outcomes in most of our hospitals, across the country. In fact, I feel India as a country, as a nation, has done extremely well in terms of handling this crisis. If you see the mortality rates in other countries, whether it's Europe or in the United States. So when you look at how those countries have handled the pandemic, so I think the one great positive aspect that I've seen is that people have, healthcare professionals, everyone has risen up to the challenge. And as you rightly said, it's important that, we remain positive. And I think that positivity certainly helps us in overcoming this challenge. And I'm absolutely certain that within a couple of months, of course, a vaccine needs to be found, but there is nothing that we cannot overcome. I'm quite positive and optimistic about this.
Vijay, do you have any tips for your fans and followers? Any specific tip as to how to deal at this moment?
See, I think all the experts are quite unanimous in their opinion in terms of social distancing, maintaining your distance, the use of masks, and all the necessary precaution that one needs to take. So I think those are things which, if one can follow diligently, it will certainly help in this kind of slowing down the spread of the pandemic. And the thing that I would like to tell everyone, those who kind of are viewing this, is the fact that, the clinical outcomes are extremely good in terms of the recovery rates of individuals who suffer from this disease. So I think that's something that certainly gives us a lot of hope. And with the kind of talent that is at work at this moment, the entire intellectual capacity of millions and millions of individuals all across the globe who are working around the clock to discover vaccines, to invent medicines. So I'm quite sure that, very soon that, you will see a end of this pandemic. It will be a journey. It's not something that's going to happen overnight, but I'm quite sure, given our history of human civilization, I know it's important for us to kind of reflect back on the kind of challenges that we have faced in our lives, whether it's been the two world wars, whether it's been the Spanish flu, or, India itself has faced so many calamities. There've been earthquakes, there've been floods, and we've overcome all those challenges. So I think that's the thing that we need to take away, that, we are a very resilient race, and that we can certainly overcome whatever challenges are thrown at us.
Thank you so much, Vijay. That was very succinct and very insightful. And once again, our humble thanks for being part of this panel. I also want to apologize to Dr. Swapna Patkar, who I'm afraid I forgot to introduce. She is a BHMS certified in infection management, a PhD in clinical psychology and trauma management, apart from being a very passionate lady who's working in Sion Hospital and various hospitals until the wee hours of the morning, endangering her life, and has been through some 6 or 7 COVID tests to make sure that she's not succumbed. And now for a very, very important question for one of my favorite people in the world, that is Dr. Suchetan Pradhan. I rang him up around 2 weeks ago and I said, can we do this panel? And as usual, with all my little schemes through 27 years, he said, of course we should do it, Nish. And we put this panel together and reached out to Vijay Patil, who was absolutely so kind. He's given us this technical platform. Thank you, Dr. Mayuri, Abhishek, Preeti, Radhika, for putting this this whole thing together so beautifully and so kindly. The last panel that we had, everyone, wrote to me saying it was fabulous, Nish, but how could you not discuss vaccines? I mean, that is something haunting everyone. Every single day, people wake up with this prayer that, let there be a vaccine. Dr. Suchetan Pradhan, my question before I ask you about, your forecast as to when the vaccine will show up, my question to you is that, after all these prayers and mantras and havans going on all over the world, is the vaccine actually a curative, or is it just something that quells the impact, or does it create herd immunity? I want you to cast a little bit of light, and if possible, show us a few slides to enlighten the ignorant about what exactly should we expect from a vaccine and when should we expect it. Dr. Suchetan, you're muted, so perhaps we could unmute, please. We don't want to miss out on a word that you're saying.
Yeah, well, I wish you were in my house and you would say this to me every day, but I'm muted at home all the time. But in any case, thank you very much for having, when we discussed this and we said, let's give information, but let's have fun as well. We should give a lot of information, not create panic in the people. So first of all, let me thank Dr. Vijay Patil, the D.Y. Patil University, and all their support staff, Mayuri, Abhishek, and the rest, for having organized this wonderfully well. And we hope to do this in the future as well. So the question that we all have in our minds, Nish, is there going to be a vaccine, and what time frame are we looking at, and what will the vaccine entail, what will it involve, and how effective will it be? These are the questions that come automatically to mind. So I have, I got my slave, my son, who's an neurosurgeon, Siddhant, to do a little presentation for me. And even though I may be talking behind it, but the work is his, so we must give him credit for that. So I'm just trying to set up the slideshow here. And okay. Okay, so what we're going to look at is the vaccine for a perfect pathogen. it's a COVID-19 perspective. Please remember that this is a perfect pathogen because in asymptomatic patients are the major spreaders. So most of the other pathogens will cause some kind of symptoms before they start spreading, not with COVID. Then it changes, it mutates, it does all kinds of different things. It attacks different organs. There is not one cure for it. So there are so many things that are very interesting about this pathogen, and I prefer to call it the perfect pathogen. When we talk about vaccines, we need to understand the historical perspective of vaccines as well and what involves in making a vaccine. Okay, so we will look at that very shortly. I have been given 5 minutes and I will stick to that. The first vaccine was developed way back in 1770 for smallpox. Remember Edward Jenner? He actually tried it on himself. Amazing warrior. Average time taken to develop a vaccine, you won't believe it or not, is 10 to 15 years. We still don't have a vaccine for HIV, by the way. And the fastest developed vaccine was the current mumps vaccine, which was developed in 1967, and it took 4 years for it to develop. So we are in the formative stages of vaccine development for COVID, but over the years, have we shortened our time spans? Let's look at what involves in making a vaccine. So the first thing, overview of the development of the vaccine would be the drug discovery, the preclinical, the clinical development, the approval, and then the manufacturing of the vaccine and immunizing the people with the vaccine. So that is the whole, the phases that take place in the vaccine development. What are the components of a virus? And I think it's very important to understand this, again, very shortly. Any molecule that is, so this is your pathogen, this is your virus, and it has an antigenic protein on top of it. And that's why this virus is called the corona, because it's got these spikes. And on top of that is a spike protein, which actually adheres to the cells in our bodies, and it penetrates those cells and infects those cells. And then the viral replication starts through those cells. And that's why the disease, that's how the disease progression takes place. So an antigen is usually a protein. And what you find in the COVID-19 virus is that it's a spike protein. It's over here, okay? So that's why it's called a coronavirus. So the spike protein is the sole viral membrane responsible for the penetration, and it mediates the subsequent viral replication. So it fits like a lock and key mechanism. So it fits into the cellular membranes, and then it penetrates the membranes, gains entry into the membrane, through the membrane into the cell, and then the virus starts replicating, okay? Now, antibodies are something that are, and which will prevent the antigenic response, okay? So that is what we need to have in our bodies to combat the virus. So they are found in body fluids and are a part of your immune systems that protects the human beings and animals from infections. So antibodies will bind with the high affinity and will prevent the antigens from binding to the receptor cells, which will prevent them from entering into the cell and replicating. So antibody responses to viruses are extremely important, okay? And immune systems, the healthier the immune systems they are, the better the responses will be. And that is the whole topic of our webinar today. So that is where we are coming from. So what are the types of vaccines that are available and can be manufactured? Again, this is important to understand, okay? So you have 4 different types of vaccines. The toxoid inactivated toxins are not a part of this discussion. The live attenuated vaccine is something that you take a virus, you reduce its virulence, and then you inject it into the patient. That has its own dangers, and we look at that. There is an inactivated killed antigen, which you inject in, and again, that is something that can be used, as can be a purified antigen, okay? So a live attenuated virus is something that you take the virus and then you weaken it so that they create a protective immune response, but they don't necessarily infect or cause disease in healthy people. But The problem with this is that there is a danger of severe disease if the virus has not been sufficiently weakened. And so there is always a danger of that. Inactivated viruses will contain whole bacteria or viruses which have been killed, or smaller parts which have been killed, such as protein or sugars, which cannot cause disease. What we are trying to do in COVID is to use subunit vaccines. These are basically sugars or proteins for the surface of bacteria or viruses, and they are referred to as antigens. So these subunit viruses and nanoparticle viruses are what we are looking at. There is also another virus vaccine which is using the recombinant vector, which are gene-based vaccines, RNA vaccines, which use just a small portion of the virus particle. Then they are injected into a vector so that that vector, which is another virus, delivers this vaccine into humans to create immunity to the virus. So what we are normally using as a carrier virus is a common cold virus, and what you've been told is the Oxford University virus program with AstraZeneca and our own Serum Institute of India is a recombinant vector vaccine, which they are in the third stage of trials. Okay, so the nanoparticle vaccine and the subunit vaccine are what we are trying to do in these times, because we can do this a little bit quicker than having to do the other clinical trials with the viral vaccines, which had its own hidden danger. Okay. Also, it's very important to understand that we may also be able to generate antibodies outside the patient's body through plasma of other patients who've healed, who've been cured, and then inject them into people as an immunization protocol or as a treatment protocol, of course, but as an immunization protocol also. The only problem, and this would be great, but of course we need a large number of infected people to be able to generate this, and then you could do it in the labs. But the problem with antibody treatments is they don't produce a lasting protection, and that is one of our problems. So we have to then figure out how often do you need to take the vaccine. Like if you remember, in hepatitis, when hepatitis B first came into the scene in the 1980s, and we lost a lot of our, I lost two people from my dental school class in 1983 to hepatitis B. And that vaccine was again something that you had to use a booster all the time. So it was an antibody vaccine that was used in that period of time. So this has to be done over a period of time. The antibody treatment has only one negative, and that is that it has a limited time span. So what is the current status of the vaccines that we have today? Today, there are about 140 coronavirus vaccines under development. There are about 10 in the first phase, testing safety and dosage. So that means they've already been formulated. Then the phase 2, there are 8 which are in expanded safety trials, which are not yet tried on human beings. And the phase 3 is the clinical trials, wherein they are tried on human beings for large-scale efficacy tests. There is not a single approved vaccine on the market today. These are the different evaluated vaccines being evaluated at this point. This is the one, the Oxford University AstraZeneca that we're talking about. And the other one you may have heard is the Moderna one, which is a US-based company, which is using an RNA vaccine. So this is using a nanoparticle encapsulated mRNA vaccine. It is currently under the phase 2 of the clinical trials. So we are there, but the phase 3 will include 30,000 participants, and then it will prove its efficacy. And if it is efficacious, it will be launched it will apply for permissions to the FDA and to the world authorities. And if they agree, then it will be manufactured, and you need a large manufacturing base to have that, and then it will be distributed to the rest of the world. So yes, there is scope that this vaccine can be there in the future. But my feeling is that this is not going to be anytime soon. The earliest and most, and I was listening to a talk by Dr. Siddharth Mukherjee the other day, who said that the vaccine, the minimum time it will take is 12 to 18 months. Even if that happens in that period of time, we should be happy. The other one.
Thank you so much, Suchetan. That was a great, presentation. And I think no one is going to feel worried about the vaccine anymore. I'm sure this has emboldened a lot of people out there, that things are happening. There's a multi-pronged approach, isn't it?
Yes, absolutely. There are many people who are now actually working on the vaccine. The only thing is that this is not going to happen anytime soon. What we can expect is, if you have antibody treatments in the interim period, and then you have a vaccine for immunization, also that's a good methodology. That's a good way of going forwards. So these are the two areas in which we can work.
Just a quick announcement that all of you sending questions, please don't send them to me in separate groups. Send them to me on the COVID group, and I will try and get your questions answered. I'm going to move on to Dr. Aparna. Thank you, Suchetan. That was fabulous. All the effort put into this. Dr. Aparna Hegde is again a frontline COVID warrior, somebody who's a woman achiever all the way, somebody I have deep affection and respect for. Aparna, you've been working in the front line in hospitals, dealing with pregnant COVID patients, dealing with, such a cross-section of people who are fighting the pandemic. What do you think are the lessons that should be learned about, overhauling our public medical health system to be managed better for such a pandemic? And, I'm going to also share this, a part of this question with Dr. Vijay Patil, as to should India have learned lessons in terms of, healthcare and creating more doctors and making medical education more easy rather than making it so elitist. So Aparna, and also we were discussing just before this something very, very dear to the heart of my husband, who's, I feel, one of the pioneers in digital health. KRS Jamvwal, who's Executive Director, Tata Industries. He's been working in the digital health for the last 5 years. So Aparna, do you think the way forward is digital health, in terms of dealing with mass, situations that take over the world per se? Aparna.
Thank you for this opportunity, Nisha. It's wonderful to be here with an august panel as this, and I'll try to be brief. So I think in every crisis, there's an opportunity to learn lessons, and I hope that we learn it now. Our public health system, which bears 80% of the load, has always been overcrowded. When I was doing my residency, we were working at 3 to 4 times a capacity. I did my residency in Sion Hospital before going to US for future studies. And the thing that we really need to learn is that one is our investment in healthcare has to increase, really, really increase. Second very important point is that we really need to have a good referral system. Our cities are a collection of tertiary hospitals. We do not have good primary health care. If we had good primary health care now, in each of our slums, in each of our wards, we would have had a proper health post working. We do have health posts, 176 health posts, but many of them are not working properly enough, or there's shortage of staff, there's not equipment. So you do not have primary healthcare working very well. When you do not have primary healthcare working very well, you have no referral system. Unfortunately, every patient ends up in Sion Hospital, KEM, Nair, or some of the private tertiary hospitals. So it's extremely important that we learn from this and ensure that we have develop clinics in each ward, or the health posts are improved to be able to kind of give normal care. During the COVID situation, asymptomatic patients or mildly symptomatic patients could have been taken care in the wards itself, right? And then you would have a referral system where the ones which are moderately more severe would go on to the secondary level hospital and tertiary level hospitals. They've created that network. You have the COVID care facilities, CCCs, then you have the DCHC, the middle rung, and then the COVID hospitals. But unfortunately, because of the fact that there is a whole shortage of equipment, supplies, and because patients do not realize, that, this referral system exists, or the fact that they've always gone to a Sion hospital, they will end up in Sion hospital. So you need to have proper primary health care, a good referral system, develop each level of care very well. And when I talk about that, our population has increased fivefold in the last 2 decades, but the number of hospitals we have remained the same. Or the equipment, supplies, and infrastructure has not increased. Correct. So it's very important that we match our supply and demand. And I hope that we really look at the situation and ensure that.
Are you seeing signs of a wake-up call at this moment? Are you seeing that there will be some amount of change going forward in India?
Absolutely. That's the whole point. I mean, the fact that we've already done it for COVID, right? In COVID, we have the CCC, the DCHC, and the COVID and the DCH hospital, the COVID hospitals. I mean, if we can kind of ensure that this model exists and works, we already have the infrastructure in place. And if we kind of go ahead and, ensure that each of these facilities are able to kind of give the kind of care they're supposed to be giving, and we can already see that, right? With the fact that for a long time, we needed, data on ICU bed availability. And overnight, government has done that. The BMC has done that, right? Even Delhi government has done that, right? So you get information about bed availability now, which is something that was a need since a long time, even during normal times. So government is moving towards doing these, improvements. So improve our primary healthcare, improve referral system, match our supply and demand in terms of equipment, supplies, staff, right? I mean, we are really understaffed, and the existing staff is bearing a major chunk of the burden, which will be really, looked into by the government, and I'm hoping that this will lead to that. Honestly, at each level, you need to have some kind of a division where you have vital, essential, and desirable. Vital is like this.
So, Aparna, do you feel that we need to have more people going in for medical healthcare as a profession? Vijay, how do you feel this is going to be addressed now?
Yeah, I think Dr. Aparna has mentioned a very important point, and definitely GDP spend on healthcare needs to increase exponentially. And in recent times, of course, Government of India has been quite proactive in terms of the very ambitious Ayushman Bharat scheme, or the various health insurance schemes which they have, the state government has also implemented. But there is a need to increase healthcare professional availability across the country. And I think here public-private partnership could play a very important role in terms of increasing the health force that is required for a country. In terms of our WHO ratios, as far as healthcare professionals are concerned, there is a need to increase this exponentially. And in recent times, we've seen that Government of India has taken proactive steps to lead this increase in healthcare professionals, both in the public as well as the private domain. So I think, of course, the pandemic has kind of made everyone realize the importance of the of the healthcare sector in general. So I think it's something that needs to be done very urgently. And I think every individual, whether it's a public sector institution or a private sector institution, they have a role to play. And if both of them can work synergetically and complement each other, a very strong and a robust healthcare system can be established in our country.
Yes, absolutely. Dr. S. Narayani, the head of Fortis Hospitals, what is your take on this? I mean, we have now, I think, passed 100 days of COVID. What are the things which you feel are going to help in terms of creating a greater medical health, a healthcare force? And also, I wanted to ask you, what do you think has impeded recovery at an individual level and impacted our victory over Corona? What is the message you have for the way forward?
Thank you, Nisha. Pleasure to be on this platform. So to answer the first part of your question, I think the healthcare needs to be taken to a ground level, to a district level. And yes, we need to add on to our task force. And there is a huge shortage of manpower. In fact, at this in this pandemic too, one of the issues which we face is shortage of manpower. And towards this, the whole skilling effort by the Government of India would really help in the future as well. And while we are talking about shortage of manpower, I think in Mumbai, I have seen in this pandemic, the ground level, the district level, and the basic ward level healthcare systems really come to life and come together and work together. And Mumbai defeating to a large extent the corona has been a great effort of the government and the private hospitals working together and working very well. On the second part of the question about what really impedes, I think we are now about 100 days into COVID in Mumbai. And if I were to tell you 2 or 3 things which would have made a lot of difference in getting our act together faster or better, would be, I wish we had less of panic and less of stigma associated with the disease. Because, the panic and stigma has done 2 things. One is, people were, to start with, so worried about their symptoms and not wanting to own up to the fact that they may be exhibiting symptoms. They were more worried about testing positive, and this is society reacting to them with certain amount of stigma. Say they won't come up with talking about the fact that they have the disease. This has affected in 2 ways. Primarily, it is about the fact that they would have come into treatment late. And second, also the fact that the whole stigma and the illogical way we took up the whole social distancing and the various parameters which were to actually curtail the spread, people not talking about it and all the same, we must have added to the spread rather than people, saying, okay, I'm positive, I'm likely to be positive, let me, keep my distance and treat me. We probably kept quiet and people would have come forward, and this would have actually led to spread of the disease, for one. And secondly, we added to the mental angst of people already having distress with physical symptoms where societies and neighbors and everybody looked at COVID as a evil disease to have, and somewhere, something wrong with you, how did you get that COVID? So I wish, these were 2 things which we did not have. It would have made a lot of difference. I kept speaking to my healthcare workers when we started this off, that don't have fear. And this is not to oversimplify, but I call this is a flu-like syndrome, and this is a branded flu which is called COVID. And flu kind of thing is, respiratory illness is quite common in India. So if we understand it and go about treating it, we should be able to largely get people treated. And we mustn't forget that from the beginning, we knew 80% of these cases were going to be asymptomatic, a few were going to be mildly symptomatic, and there's only a small segment of the total people infected who are really going to need hospitalization and needed critical care. So while things are a lot better today, but I would say that the overall outcome would have been easier, faster, less anxiety, less stress, if we had less panic, if we had less stigma, and if we understood the basic logic of the isolation and the lockdown and the social distancing and wearing the mask. We would have helped ourselves better. We would have helped people around us better. That's my take.
Wow, Dr. Narayani, I have to personally thank you, because I've written a lot of many articles about stigmatizing this COVID-19 disease, and I feel people are acting very rationally in terms of treating people very badly that have tested positive. Thank you for coming out and saying this, and thank you for showing bringing the prism of logic to this current pandemic. One of the reasons for this panel was also to discuss what are, of course, there's a lot of research, of course, there's a lot of medication, but there are so many things that we can actually do to avert a bad case of COVID, or even maybe even not get it. I mean, if you're lucky. My personal opinion, Dr. Narayani, is that everyone's going to get it once in their lifetime. But I hope I'm wrong. And I hope people like Kinita, Mickey, and Anish, who have come here to share with us, what can we do to actually by improving the quality of our lives, improving what we eat, doing things which are very natural. I think we've all got a wake-up call. Even my parents have started, walking a little more feverishly and having various tonics and medications. They've always enjoyed their fried stuff and all that, but now they're giving up. So, Kinita, I want to start with you. You've been my personal nutritionist. And, if people feel I'm looking good, I'd attributed it to you and to Mickey. and also to Mukesh, who's, pioneered homeopathy. My question to you is, as a nutritionist, as a sports management expert, can you tell us a few things that people should be doing right now? I think people should make health a priority right now, isn't it, Mickey and Kinney? So, Kinita, I want you to start by telling me what you feel people should be doing.
Sure, sure. Thanks, Nisha, for this platform. And I first want to just say I completely second what Dr. Narayani said. And I so agree with her. I strongly hope that people understand that stigmatization of this particular COVID disease that people are getting is one thing that is only going to require the patients with more mental stability. So I hope the society gets a little bit more sensitive towards people who have come positive. But from the nutrition point of view, I strongly feel that nutrition can play a magical role in a person's immunity. However, unfortunately, sometimes we feel more is better, so more, and then the whole vitamin C matlab shuru ho jao, let's go 500 mg, 1000 mg, 2000 mg. In the day we are taking lemon shots six times a day and thinking that it's just going to solve, or it's just going to make you absolutely immortal towards COVID. But the fundamental understanding is that if you are consuming a wholesome diet and you're consuming all the required nutrients, you are internally at a much more better strength and shielding your immunity better. The biggest problem that I see today with people is that they believe taking overdose of certain vitamins is okay just because it works with immunity. And luckily, vitamin C is not toxic because excess of it gets excreted in the urine. But there are a lot of vitamins that are toxic, and just to give you an understanding of what vitamin C does is it is something that the diagram that Dr. Pradhan was showing, where you connect to the antigen of the protein on the top. So basically, your vitamin C is getting connected to your cells and creating certain kind of antibodies which then fight against the free radicals, and these radicals are what are damaging your cells, and they are the ones that are damaging the respiration. So your body gets stronger. But the bottom line I want to explain to every viewer out there is that vitamin C cannot prevent. It's not preventive. It's not going to prevent you from getting any kind of a cold or a cough or even COVID. But if you did catch a cold, the severity with which it will come and the duration for which it will last is going to shorten. So you are building an immunity to deal with that particular cold, cough, or respiratory dysfunction. You are not shielding your body, and you're not making your body as, nothing can happen to me if I'm going to take 2000 mg of vitamin C. So the message is tops is 2000 mg, the tops. Okay, do not take beyond that because you're only going to excrete, because your actual requirement for a general population is only 90 milligrams per day, and which is very easy to consume. Half an orange a day and you're going to get your 90 milligrams. So really, you don't need to overdose on 2 lemons in the morning and oranges in lunch and taking a juice in the evening, and it's not going to help you. So let's be moderate over here when we are fighting the COVID, and that's the message I've been giving a lot of my clients as well. Don't overdo, eat healthy, and don't go on restrictive diets at this time when everybody around us is vulnerable. So, when you...
I hope you remember that when you give me a diet, because I hope you give me lots to eat, Kinita.
Lots to eat, because, removing a nutrient is not the way to recover. And I'm sure Dr. Mickey Mehta will agree with me as well, because
yes,
there's of exercise as well. You need recovery. You need
food. Who's responsible for Priyanka Chopra, Amir Khan, Lara Datta, Bipasha, Smriti Irani, Preeti Zinta, and so humble. I mean, if you were to ask me the one thing that exemplifies him, it's his humility, and he picks up the phone in 1 second and is so generous with all his reservoir of knowledge. Mickey, I want to ask you, does yoga and Ayurveda have a cure for COVID? I mean, people are talking about today. I'm forgetting his name. What is the favorite of Mr. Modi? Ram, please somebody guide me.
Amit
What?
Shah.
Okay, the yoga guy who's
Baba Ramdev.
Baba Ramdev. So Baba Ram, close enough, Ram. So Baba Ramdev has come out today and said he's, creating an Ayurvedic medicine that's going to cure COVID. What are the chances of survival with natural remedies, Mickey? And do you recommend yoga? I mean, Kenita's given us such a fabulous explanation about free radicals and how to deal with, the nutrition situation. What do you feel about yoga and Ayurveda?
So let me tell you, the understanding of health and the definition of health is the etymology healed high, healed hem, healed how. Health is organic unity, organic orchestration of all functions and systems of human body. Health, once again, let me say, organic unity for cellular community, which in turn builds immunity for humanity. So, and this health could be attained through creative and productive sciences. So we have creative and productive sciences. So Ayurveda is a creative science of life, not preventive. And yoga is a productive science of life, once again, not preventive. Let us understand. So thank you, Dr. Vijay Patil, and thank you, Dr. Mukesh Batra, for giving Ayurveda and homeopathy to India. Now coming to the fact. What is most primary to human life? That's breath. Primary to human life is breath. So I have breath for breakfast. So that's my cosmic nutrition. I soak myself in the sun every morning. That also is my cosmic nutrition.
So are you telling our viewers out there
Yes,
that
yes.
Okay. So if you
just one more thing. And coming to most important, the mindset. I'm not talking about positivity. I'm not talking about negativity. Diseases are born out of desires, and diseases are nothing but the opposite of ease. So Vairagya, distancing from desires, Kama, Krodha, Lobha, Moha, Madha, Maya, Matsara, will make you prevent from most diseases. Now coming to the most important part of life, that attitude of optimism. So the leading scientist, biology scientist Bruce Lipton says that your belief can change your biology. Mickey Mehta says your breathing can change your hormonology, and your faith can change your physiology, and your prayer can change your psychology, prayer and meditation. And these are all scientifically validated today. If you were to see the science of neuroplasticity, if you were to see the science of epigenetics, if you were to see the science of telomeres and telomeres, thanks to Elizabeth Blackburn, and if you were to see the science of consciousness today, so Dr. Dean Ornish, Dr. Roger Penrose, Dr. Deepak Chopra, they all have brought this science to fore to establish the fact that optimism keeps you away from disease and keeps you in high immunity. When this COVID started, I innovated a breathing technique called poison bee, prevention of infection seeding optimal nasal breathing. And this was very well exhibited on Tata Sky. So prevention of infection seeding optimal nasal breathing. It goes like this. If you look at me, you can do it with me if you want to. So we start with the nose, very invigorating, vigorous in and out breaths through the nose, and stomach going out, stomach going in, the bellow action. So like this. And then if you want to avail all 5.5 liters of cubic capacity of lung air and empty your 5 lobes of lungs, 2 on your left, 3 on your right, if you want to invigorate your respiratory tract and push the viruses and germs out, if you want to dilate your sinuses and do thermogenesis there, increase the temperature beyond 97, 98, there's a very good chance the germs, the viruses, and the bacteria will die. Further on, the adenoids behind your nose will drain the germs and bacteria very effectively with this vibratory frequency. And most important, your thymus gland will secrete T cells, and your bone marrow will secrete B cells. Your pineal, your pituitary, they all put together will secrete a lot of immunoglobulins, and your interferon, your interleukin 2, which otherwise is available for $2,000, $5,000 a while, will be available to you freely, because when you breathe in with vigor, your diaphragm moves almost 12, 13 centimeters, and that's all about breathing. When you come to asanas, asan means a seat of awareness, seat of consciousness, where when you are seated, postures in poetry move from one to the other. Four things
That's
happen.
brilliant, Mickey. Thank you so much.
Okay.
I think you're going to be part of the metamorphosis of all of us. I'm going to come back to you, Mickey, for more.
Yeah, okay.
I just want to pull in Dr. Mukesh Batra. Mukesh, thank you so much for canceling your other webinar and giving us precedence. I'm truly obliged. Mukesh, there's a lot of buzz, especially augmented by not only you, but even Rajiv Bajaj has been talking so much about Camphora 1N. He's actually distributing it to a lot of people all over. I want to ask you firstly what you feel about arsenic alb. Can it mitigate COVID? And then I want to know about what is your view about Camphora 1M, because Dr. Jawar has come out and said quite clearly that it antidotes all other medicines. And also, I'd like you to add, what is the role of homeopathy vis-a-vis COVID?
Thank you, Nisha. And anytime, anything for you. So I'm so happy to be here, and
You've
thank you
been
for having
a
me here.
guardian angel in my life. Thank you for always being, and thank you for couriering me the medicines, through this entire pandemic.
No, thank you very much. I think I'll start with your third question first.
Please.
Answer that first. That what's the role of homeopathy in this pandemic? Let me start by saying that there's a history of homeopathy being very successfully used in pandemics in the last many centuries. Now, if you go back to, let's say, the Spanish flu, there was a mortality of 30% with the current medication, and there was a mortality of only 1.05% with homeopathic treatment during that time. Now, that's about 100 years ago. Similarly, the government of Cuba, for example, for leptospirosis, has used homeopathic medicine as well for preventive as well as curative. The Andhra Pradesh government many years ago used homeopathy medicines as a preventive and curative belladonna for viral encephalitis. So there have been examples of homeopathy being used successfully for pandemics in the past. Now let's come to this pandemic and let's understand how does it work. So let me explain this to you in a very simple manner. There are two sides. Homeopathy believes there are two sides to be balanced in case of an infection or in case of a pandemic. On one side, you have the virus, which has virulence. And on the other side, you have the host, which is the human being, which has immunity. Now, depending on which side is higher is where the sickness or the health falls. So let me, be categorically clear that if the virulence of the virus is very strong, then it's possible that you will still fall sick and no kind of medication will then help you. But, as Kenita said, that probably then if you are prevented, the problem will not be so severe and it will not last so long. Okay. Let me also mention here that, this whole panic about, virus and, COVID, let me mention here that our body has more than thousands and millions of viruses and bacteria. And a lot of them are actually good for health. So this whole thing of saying that, I'm now cowed down with the virus or I'm falling sick, I'm saying that's not really true. I'm saying the body has actually the capability of actually fighting naturally, and this has been happening all along. I remember, many, many years ago, and I'm talking about like 40, 50 years ago when I was a medical student, my pathology professor used to tell me, just eat an extra chapati for the worm. That's all. I'm saying keep your worm quiet, and there's a kind of a symbiotic relationship that you have. So why worry about all this? On the other side, you have the immunity of the host. Now there are two ways of making this happen. One is to a specific pandemic or endemic. So now when we are talking about COVID, then according to homeopathy, there's something called genus epidemicus, which means that if you study the first few cases and you map those symptoms, and if you find a medicine for that, then that medicine can be used a kind of a vaccine in homeopathy against that particular virus. Now, this is what the Ayush Ministry has recommended, and that is how arsenic alb comes in. So they are now saying that, arsenic alb, they've done research on it and they are recommending it, the Ayush Ministry. And we have given, to the police force, the Gujarat government has done some clinical trials on it, and they've seen how it helps people, at least in stage 1 and in prevention, not in severe cases, how it can be helped. So there's a certain amount of research that has been done, Now, there are also, it's a free country and, everybody comes out with their own suggestion. And there are also individualistic viewpoints to what one should take. And, Rajiv Bajaj is a great, proponent of homeopathy. And let me also say that, even I've been one of his doctors. So, and he's a great, great friend. So what he's saying is anecdotal from his point of view. But arsenic alb is something which the government is recommending. There's a lot of case studies that have proven that works. We have distributed more than 1 crore, doses of arsenic across the country to needy people as well. So I would go with arsenic alb as a preventive,
It is recommended by the Ayush Ministry.
It's recommended by the Ayush Ministry, and enough research has been done. A group of doctors have sat on it. So, really, that's where it stands. I just like to use this platform and this opportunity also to talk about one more thing. We all, we all talking about the physical aspects of COVID. We are talking about, but nobody's talking really about the emotional and the mental aspects. When this came about, and today almost 200 of our clinics across the country and all over the world are open. I mean, we have doctors going regularly, we have support staff going, sometimes much against the wishes of their families. They're all frontline warriors, and they're doing their best under the circumstances. So what we are not looking at is, we are not looking at the fact, for example, that depression has increased from 16% to over 38% in these last 2 or 3 months of COVID. We are forgetting that fear, according to the Indian Psychiatry Association, has gone up by 20%. We are forgetting that people are anxious, and all these WhatsApp messages and this kind of paranoia and the panic that is being caused all around is actually detrimental, So you really need to make sure you have a positive mindset. Now, homeopathy, because it is holistic medicine, because it is mind-body medicine, because it can actually help you also to get rid, and your body reactions against fear, anxiety, depression can actually also get treated. So which is why this is something that you should really, go to your homeopath, consult, and before you take any medicine, you should anyway consult your doctor. So, you should never self-medicate in any case. So I think
that's so much.
Yeah,
that's really very important. And I hope next time I come to you with stress, you won't tell me to have a cup of tea and forget about it. Because the last time I came to you with stress, you said somebody like you can never get stress. I love the confidence, but thank you for touching upon anxiety. Speaking about the Ayush Ministry, we have with us a consultant from the Ayush Ministry who's working closely with the Ayush Ministry for acupuncture, Ayurveda. Dr. Anish Gupta, it's such a pleasure to have you here. What everyone wants to hear from you is, how are Ayurvedic medicines? Do you have any recommendations? And how is Ayurveda and acupuncture working to mitigate the situation of COVID? And do you have any recommendations? And how many sittings does, acupuncture take? I'm a fan of acupuncture, and I know it's not painful at all. But how many sessions would you think it? Would it take to actually create immunity in a person?
Thanks, Nisha. First, I should have to tell you about the mode of action of these three, and little introduction about what is acupuncture, what is Ayurveda, what is yoga, and what is other alternative medicine. Because you can say it is nice to promote these alternative medicines. Present government is also showing its interest to promote these medicines.
In fact, if I'm not wrong, it's the first government ever that has encouraged and shown so much encouragement of alternative forms.
Yes, that's why I'm saying. But the question is, which therapy is alternative? Ayurveda, homeopathy, acupuncture, Unani, or Siddha? No, to me, modern medicine should be alternative. Why? Because our traditional medicine should be in first line of treatment. because it's natural and free from side effects. I'm not against modern medicine. It is a miracle medicine and life-saving drug. In 1947, you can say average lifespan was around 31 years, which is now around 61 years. Credit go to modern medicines, but they should be used in emergency conditions only. You see, in China, 95% people use their traditional medicines, and only 5% people are using modern medicine. In India, it is, you can say, it's the reverse. Please think over this. Just I want to say, introduce Ayurveda, yoga, and acupuncture have the same theories. These are because these are traditional medicines and they are having very long history. All focus on balancing of energy and to increase immunity. Any upsurge or downfall in energy channels create ailment. In these therapies, we focus on mind, body, and soul. We treat the body as whole to clean the root cause. Because in modern medicine, we focus on symptoms only, but in these therapies, we work on root cause. Ayurveda based on the theory of Tridosha, Vat, Pitta, and Kapha, and acupuncture based on the theory of Yin and Yang. In this, just we should have to clear the mind. Mind is the first line of treatment in all these threes. Nowadays, our mind is fearful of COVID. Fear consumes our maximum energy, so get rid of this by playing some spiritual songs, mantras to create positive environment in home. Stop watching negative news, which is the main cause of corona. You can say fearful factors coming after seeing negative news. Minimize use of electronic media. Self hypnotize yourself by giving some positive thoughts that my body is healing. God's protection cover is around me. Nothing negative can harm me. And second comes the body, which is the main part. Our lifestyle plays a major role to increase our immunity. You can see people from remote areas are more healthy and less prone to COVID due to their healthy lifestyle or early to bed and early to rise, taking a healthy and natural diet. I say do daily exercise, yoga, pranayam, just like Mickey have explained, to keep your body healthy. Use anti-inflammatory and blood thinners, which is the main line of treatment in modern medicines. These are available in Ayurveda, decoction of herbs like black pepper, haldi, tulsi, dalchini, and ashwagandha. Suck black pepper and long to clear your throat because the main stay
Can
point.
you explain to us what is black pepper, Dr. Anish Gupta?
Black pepper, kali mirch, you can say.
Oh, black. Yes, black pepper.
Black pepper, that is kali mirch.
Okay.
And long to clear your throat. Do gargles of haldi and black salt. These are common factors to clear your throat, which is the mainstay area of the COVID.
Correct. And are there any Ayurvedic tonics like last time we spoke about Lakshmi Vilas? Are there anything you'd like to recommend?
Yeah, there are some ready-made formulations just like Lakshmi Vilas. You can take twice daily, one tablet morning, one tablet evening with honey. That is the best, you can say, dose to increase your immune strength. And second comes just like for respiratory distress, you can use spasma serum. This is made by Chark Pharmaceuticals. And I'm using this spasma since last 25 years on the patient. This is giving very good, excellent results. So you can use these ready-made products if you are not able to make some of these kada type. So because there is some people are so lazy that they cannot make kada. So you can take these things just like spasma to in spite of kada.
Thank you so much. I'm going to come back to you, Dr. Anish, and Dr. Mickey Mehta smiling through this whole thing because you just resonated his thoughts because in terms of prayer and shield of light, because he's one person that was, while he's talking to you, he breaks into beautiful mantra, and it's therapeutic just listening to you, Dr. Mickey Mehta. But I want to come to somebody who's a very humble and a very kind worker, always reaching out to help us all, helping people have blood tests, COVID tests. Dr. Swapna has been working at Sion Hospital, endangering her life every single day. And before we speak in the night, she said, Nisha, let me get out of my hazmat suit before I can talk to you. You've been fighting the very treacherous COVID, Swapna, and despairing and nearly crying at night when you see some, horrific sights in front of you. You've been panicking. Can you tell me that since the lockdown has been released, do you feel that there's a little more confidence in people? Has there been, I nearly see a surge of some amount of positivity converse to what we had all imagined, We live in one of the densest cities in the world, that is Bombay. But I see a very, Dr. Sangeeta Pikale, Dr. Sona Pungavarkar, all the doctors who were on our panel last time, Ashish, they've all been talking about a sort of positive wave. Am I right in imagining this? Could you tell me some pointers you've learned along the way working with COVID patients?
To begin with, I'm really, really very happy to be here on the panel. And I would like to start with a positive note. When I joined the fraternity, I was told that one doctor cannot be friends with the other. But right now in this pandemic, one of the most positive things that I have seen is that the healthcare industry has come very close to each other. And we have been talking to each other day in, day out, checking in if anyone has an ICU available or not. So yes, I see a lot of positivity in the healthcare industry. I think all the hospitals are connected with each other, and we all call up each other and check if we are fine. So that is another amazing thing. I remember how many times I have called Dr. Narayani to check on her and is everything okay and all fine, and can I get a bed please. So that is one
What are
positive
some
thing
of
that I see in
the
healthcare.
impacts you see, Sapna, of the opening up? Are you seeing a positive wave? Because today I got a graph showing a dip in cases. And can you tell us what you've learned in terms of dealing with patients in the current scenario?
There are few learnings that I have had. Is that watching too much of YouTube videos and watching all the crap that comes on WhatsApp had worked on people's minds. But I think people like you and there are many others who have come forward and always talked about real information, like in your COVID group,
There
we
are
are
thoughts
filtering all the information,
I
putting the right
apologize,
things
Swapna, but there's
in.
something
So
wrong
I
with
think
your
now
audio.
people are understanding that every information. Am I audible right now?
No, Swapna, there's something wrong with your audio. You'll have to fix it. I'm going to just wait for, like last time, wait for you to fix it while I jump back to Dr. Vijay Patil, if you don't mind.
Sure.
I'm going to ask Dr. Vijay Patil. Dr. Vijay Patil, it's my personal belief, and a lot of people agree with me, that your contribution to the fight against COVID has been very, very significant. I want to know that after running the D.Y. Patil University and the hospital for such a long time, what do you think is what do you think are the learnings in terms of education? Do you feel education is going to change here on? And what, it is, I think D.Y. Patil is one of the best educational institutions. How do you plan to incorporate changes that we've all, seen happening during COVID? How are they going to impact education going forward?
Yeah, I think one of the questions that's always been asked to me during this times has been the fact that what role would online education play, and would it actually replace your conventional form of teaching? So that's something that's come up. But personally, I feel that uh, online teaching can never replace conventional form of teaching. It can only facilitate it and assist it. And what I've always felt that when you go to a university, you essentially address three facets of a human personality. That's the mind, body, and soul. So when you speak about the mind, it's all the formal teaching, which the skills that you impart to the students. The body is about all the physical education that you can get yourself involved in the premises of a university. And soul is that intangible which you build leadership qualities, you build other qualities in students through different activities which are held in the university. So I don't necessarily feel that online education will replace conventional form of teaching. It can supplement it, certainly. Although I do see that online teaching, even in the pre-COVID days, was something that eminent institutions were actively pursuing. In times to come, it would be used more aggressively. So I foresee that educational model in the future will be more about hybrid learning, where you have your conventional form of teaching taught in your physical premises, which will be then complemented and supplemented with your online resources there. So that's
What
what I
I'm
feel.
hearing is that education is also going to become way more accessible. Is this the right, information we are hearing, that education is no longer going to be elitist. It's going to be accessible to more people going forward.
Absolutely. I think technology has been something that's truly empowered people. And I mean, look at what you've achieved over here. We have about so many people sitting on a panel. If you had to do this 7 or 8 years ago, you would have to book a studio, you would have to get a producer in, a video editor, and so many other individuals to put this thing together, and so many people traveling from different places. So I think technology has been a true enabler, and it's truly empowered people of our generation. And definitely, because of the advent of technology, access to educational resources would become much easier, and it would be a great enabler in terms of providing access to those students who cannot necessarily afford to get into institutions because of the high cost of education. Already we are seeing so many different platforms. You might have heard about Coursera, you might have heard about edX, where you have some of the best the best experts, domain experts in different fields coming together, curating content, curating programs, which are then accessible to students all around the globe. So definitely, I think it's a great era, and that's where I feel technology has made a significant impact here.
Thank you, Dr. Vijay. That's very enlightening. And I do hope you're right. I do hope more Indians can. I think the way forward for India is greater education and greater hygiene. Wouldn't you agree?
Yeah, absolutely. I think education and healthcare, those are the two pillars on which a great nation is built. And I think it's something that we truly have to, I think everyone now understands, the importance of education and healthcare.
Very true.
Towards
Dr. Parna Hegde, what do you feel? I mean, can you add to what Dr. Vijay Patil is saying in terms of how do you think lay people should stay safe going forward? And how has the lockdown being lifted? How are people going to, how are they going back to work? Are they safe? Is it okay? Is it going to be okay? Or is there going to be a necessity for the lockdown to come back into play?
I do think
Dr. Swapna, I'm going to come back to you. I hope you can get earphones to sort out your, I think it might be advisable. Dr. Aparna?
Yeah. So, there are some good points and some, things that we have to really take care of. The lockdown has to lift because economy has to come back to normal. People have to go back to their jobs, etc. But if we take care, the good points about the coronavirus in India is that 80% are asymptomatic, literally. Our case fatality rate is low. It's only 2% to 3% who are going to end up needing ICU care with ventilators, right? So if we take care, while we're going back to our work, we'll be able to kind of, not ward off, severe crisis in our own families. So if we just do 2-3 things very, very well, when we go out, think that anybody you meet is an asymptomatic carrier, so ensure that you always have a mask, right? Always wear a mask. I see too many people outside not wearing a mask or not wearing it correctly. So please cover your nose and your mouth. If you're using a cloth mask, please ensure you're not using one which has got a sieve or a honeycomb kind of pattern. Use one because that would not keep the virus away. If you're using an N95, do not use one with an exhaust valve because that kind of really transmits the virus out. So please remember that. So wear a mask all the time, right? Get into the habit of washing your hands and using sanitizer. Know that any surface you touch may have a fomite. Maybe carrying the fomite. So ensure that you sanitize yourself properly and or wash your hands regularly. When you touch objects or surfaces, very important to remember that. Third thing, remember that there are like 3 places where you really need to take care. That is, closed spaces, right, which are or crowded spaces or close contact settings. Correct. These 3 places, if you take care, right. The good thing is that if you're wearing a mask and the other person is wearing a mask, even if asymptomatic, you're not going to get it. You need 20 minutes of exposure to somebody who has cough or a sneeze, right? And asymptomatic is only when you get the virus, right? So if you are coming across an asymptomatic person while walking, just generally, you're not going to get the virus. So remember that. So wear your mask always. Ensure that the person you're coming in touch with is wearing a mask when you come in close contact with a person. Right? Take care of yourself in close spaces and close contact settings. If you do that, you're going to stay safe.
Thank you, Dr. Aparna. Dr. Narayani, you want to add to that? Do you feel that the lockdown should have been stayed on longer? Do you feel that it's okay that we are trying to adapt to the new norms and trying to become more resilient as human beings? Or
Yes,
do you think there's
absolutely. I'm in favor of the lockdown getting lifted and people getting back to normalcy, because we can't forever, sit in some corner and hope that the virus will go away. I think we have to learn to live with it. And I'm not going to repeat all that Dr. Aparna said. It basically used logic. The virus is not, flying at you. If you know how to keep yourself a little bit protected, it's just fine. But I also want to add, apart from all taking care and everything, there is a good chance that you may get an infection. If you get an infection, don't worry about it. Most 8 out of 10 cases are not going to have any major trouble. It will come and go and you won't even realize that you had an illness. And for those who have a little bit more symptoms, don't wait at home waiting for things to get worse. Reach out for medical help. And especially for doctors, actually, don't try to treat yourself. There is so much information available on WhatsApp and YouTube and everything, but doesn't matter. Be a patient, reach out to somebody who's an expert, ask them what's the right thing to do, and then come into the hospital in time if you need to actually get treated. And more additionally, there is also this whole worry which patients have, and these are not just for COVID illnesses, but for anything else. People wonder, oh, this hospital treats COVID, that hospital treats COVID, where should I go? Is it safe? Is it not? Don't worry. Anybody who treats COVID will treat non-COVID as well. And actually, anybody who treats COVID is, at the right place. Anybody could be COVID. So walk into any place, take care of yourself, and reach out for medical help early in case you feel you have symptoms. And for all you know, you may be managed at home. You don't even need hospitalization. But don't come in late. We see a lot of patients coming in late. That makes recovery difficult, that people are ending up going into the ICUs. Perhaps if they'd come in early, this wouldn't have happened.
And perhaps if they listen to, people like Mickey and Kenita and Anish and Mukesh, they may even have, an easier time of it and just cross over this tumultuous apocalyptic situation a little easier. Am I right, Mickey? Mickey, can you add to Dr. Anish in terms of, any suggestions you have, like, some real bullet points about what people, if you had to give 5 bullet points, what would they be?
Okay, I already spoke.
I'm coming to you for Neti Kriya for sure.
Yeah, I want to ask Mickey that question.
Neti Kriya, because that is Suchetan's domain.
Okay.
No.
Suchetan, you're on mute. Can you please unmute?
I actually wanted to ask Mickey to also talk about Niti Kriya, because I've been doing it for a little while now, and I think it's really effective. So I would like you to explain that to people.
Do you guys know that water has memory, sound has a shape, fire also has its own colors more than what are visible, and earth has a vibratory frequency, and Akasha is a non-local correlation infinite connector. So, when Ayurveda says that all these 5 elements within us are good enough to heal us, and yoga says that our sacred geometry gets in congruence with the sacred geometry of the cosmos, and it gets into confluence with the sacred geometry of the cosmos, and the lines which separate us, they get obliterated to make us one bundle of vibratory orchestration, a symphony. Now,
can I request you for 5 bullet points, please?
Okay, 5 bullet points.
We have laymen looking at this and they really want to know from Kenita and you, bullet points about what, supposing you were to tell me, get up in the morning, do Surya Namaskar, do Neti Kriya. I want 5 bullet points.
Okay, first of all, have breath for breakfast, rhythmic breath. Number 2, soak in the sun. Number 3, have calibrated challenge to your body in terms of exercise, stretch, contract, because champions are born out of challenges. Number 4, have a lot of laughter, recreation, joy, fun in life, without which your healing mechanisms will be at all-time low. And most important, sleep like a baby, wake up like a daisy, sleep every night with the wish to heal yourself, and wake up every morning with a promise to heal the world. Then you will get this world energized, optimized, naturalized, maximized to get it Mickey-mized.
Sapna, thank you so much, Dr. Mickey. Sapna, have you sorted out your audio? We are still waiting, all of us, to hear from a COVID warrior who goes early in the morning, comes late at night, and is battling something very, very frightening.
Am I audible now?
Very. Tell us.
Okay. So I think the lockdown now is taken up and people have decided to take care of themselves. I see a lot of confidence in people, and because there is a lot of education that is happening now, people are reaching out to their nutritionists, taking up plans and meeting psychologists because they're attending different webinars to take care of their mental health. So yes, people are taking care of themselves, but fear still exists. And people are still scared. If they have even one sneeze makes them paranoid. So I have a lot of calls coming in day out, asking me, I have a little cough. I think I have COVID. So everybody now is a little scared with the virus. So with the confidence, yes, there is a little bit of fear still existing.
Thank you, Swapna. Thank you so much. Kinita, do you want to add to what Mickey said in terms of, is there anything like too much on the various immunity boosting foods that we're hearing of?
Yeah.
Like you mentioned, vitamin C. But I want you also, like I requested Mickey, to give us 5 bullet points. If you were to give us 5 bullet points of what is to be done, And so, Chetan, I'm going to hold you to the Neti Kriya. You will have to tell us about it. Yes, Kinita.
So, if I had to just look at 5 foods that I basically feel are magical, that work very well for an Indian body type's immunity, and that suits us, and I would go back to our roots, and I would say black pepper, like even Dr. Gupta said, black pepper. So black pepper, definitely ghee. So, doing like a concoction of black pepper with a little bit of ghee and haldi. These 3 ingredients are just classical. Along with that,
mix these together and have it
Yeah.
first morning.
Yeah, make it like a warm concoction of halka sa ghee, put little haldi and put little bit of black pepper and just like a teaspoon and just lick it off. Take ginger juice once a day and lemon shot once a day. And I think this pretty much covers everything that is related to your respiration and related to your immunity. Over and above that, then definitely following a good nutrition plan, sustainable, not doing ridiculous diets, not, starving yourself, not just drinking fluids. That is going to then further bring the immunity down. So these are my 5 bullet points, and I'm going to quickly repeat it: lemon shot, ginger juice, black pepper, ghee, and haldi. So if you all have watched
the lemon shot, would you recommend to our viewers to be had as a shot, or is it also okay to have it as a lemon drink without sugar?
The more concentrated, the better. So just squeeze a lemon first thing in the morning. This is not the season for amla. Otherwise, I would have said avla shot, because avla is double the amount of vitamin C than lemon. So lemon right now is easily available. So just take a concentrated, squeeze it in a little shot glass and just take a shot. That's it. Nothing else.
Doctor, I want to add to this 5 bullet points. If you were to tell us 5 things to do, all your viewers out there are looking out for tips to avert a bad spell of this flu, or even just sidestep it altogether, what would you say? Dr. Anish, you're muted at the moment.
Hello.
Yes, 5 bullet points.
First, you should have to remove your fear, which is the main fear factor of the COVID. And by this, second is to self-hypnotize yourself that I am okay, God's protective layer is around me. That is the main thing. When you are out of fear, nobody can harm you. And third is your daily habits, your daily lifestyle. You should have to go early to bed, early to rise, do yogas and pranayams. And there are some acupuncture points. You can say other you can, if you cannot do acupuncture, then you can do acupressure. There are some acupressure points which can increase the immune system. These are names as stomach 36. You can write in stomach 36. These are LI 11, lung 7. These are the points which increase the blood flow in the body.
Thank you.
Yeah.
Thank you, Anish. Chetan wants to jump in with the, and so Chetan, can you also tell us about Neti Kriya, and then I'll come back to, please feel free to put your hand up and interrupt at this moment. We are in our last half hour, so we are going to keep this very informal and interactive.
Just want to say thank you to Dr. Vijay Patil. He wants to leave. He's been here longer than he's promised us. So thank you again for coming. And it was wonderful having you here.
Thank you, Vijay. Thank you so much.
Absolute pleasure. It was a pleasure interacting with everyone. Yeah.
Thank you. Thank you.
Thank you, Dr. Vijay.
Vijay Patil, you've done so much for medicine, for education, for cricket. It's truly an honor, and that you stayed back for nearly the whole session. For that, we are all very happy. And I thank Suchetan for insisting that you join us this time. Thank you, and I hope you'll join us again soon again.
Absolutely. Thank you so much. Thank you, everyone.
Thank you,
Dr. Patil. Thank you.
Nish, I think you should go on to Swapna because she's now got a connection done, and then I can come back in if you like.
Yes, sure. Swapna, tell us about 5 bullet points you think that people should.
Before I get to the bullet points, I'm really happy, hearing what Dr. Anish Gupta said, Dr. Miki Mehta said, and Dr. Kinita said. There are a lot of patients who are being treated at home. I'll be very happy if we could collaborate and make a booklet out of it. And, if I can share it with the patients who are being treated at home, it will really help everyone.
Thank you, Dr. Sapna.
So
Doctor,
that is one very important.
I have an important question for you. Do you think you could throw some light on the hydrochloroquine fiasco? What is your opinion on the new drugs on the block, like Remdesivir? Please tell me how to pronounce it. Remdesivir and Favipiravir. And then there's the new Glenmark medicine that showed us its head around 2 days ago, or maybe a week ago. Yeah, I want you to give us a little, because there's lots of questions coming in for the hydrochloroquine fiasco, for these, the research going on for these two. I'm not going to attempt to say them again, and the new Glenmark medication.
Yeah, so I'm going to go through each of these drugs one by one. Now, what's happened, unfortunately, is that when you have a crisis, you don't have time for evidence to develop. And drugs are being approved on an emergency basis before the evidence has been proved. And that's happened with hydroxychloroquine. Now, hydroxychloroquine was found to kind of act on the RNA. I mean, I'm not going to go into technical aspects of it, that it prevents the transcription of the RNA that the virus has. So they thought that it might be useful. And unfortunately, what happened is that it went through these phases of, being approved and evidence coming, it doesn't work. Again, evidence coming, it works. But now the final thing is it does not work, right? Because the WHO, the NIH from the United States, and the UK recovery trial, all three have withdrawn their hydroxychloroquine part of the trial. So please understand that, right? That's one thing.
So, Aparna, are you saying that we should not use it as a prophylaxis anymore?
I'm going to come to that. It is not useful for treatment, right? It has been shown, all the 3 arms of the trials have shown that hydroxychloroquine does not have any impact on, number of hospital days spent or mortality. So for treatment, it does not work. Now, ICMR still says that prophylactically you can use it. So all of us healthcare workers have been given hydroxychloroquine. But again, the evidence for it is very, very patchy. There's a couple of studies which are not randomized cluster trials which show that it works. So, I mean, evidence is very patchy. For treatment, it doesn't work. So that's what is the final word on hydroxychloroquine. Now, Remdesivir. Now, Remdesivir and Favipiravir, right? One of these drugs, right? These are nucleoside analogs, meaning what they do is they prevent the replication of the virus, right? So in short,
right.
Yeah. So now Remdesivir has been shown in a trial to work. See, it works early on. So if you are somebody who requires a lot of oxygen, you need high flow oxygen or you need ventilation, Remdesivir won't work. So if you're the kind of patient who has begun to need oxygen, that's when Remdesivir works. And the study published in the New England Journal of Medicine, out of 1,000 patients, there is one subset on which it worked, right? So that's why Remdesivir is now a big part of people's management protocols. And now the same thing with Favipiravir. Favipiravir is a drug that's supposed to act in mild and moderate cases. It's an oral drug, whereas Remdesivir is an IV drug. Favipiravir is an oral drug, right? So, but
right.
Understand one thing, that we have no game changer, correct? I mean, none of these drugs are game changers. A game changer would be a drug that you give and the patient will get cured. We don't have that. You're working with drugs that are used for other conditions. They have been repurposed for COVID. Now, the only one drug that has been shown to reduce mortality is dexamethasone. It's an easily available steroid. That's the only drug that's been shown to reduce mortality, right? So why? Because
senior citizens.
Can you repeat that question?
One of our viewers wants to know that does this steroid work for senior citizens or is it dangerous?
No, it does work, right? So if you look at the UK trial, it does work, and the thing is very easily available. So, senior citizens have been put on remdesivir, it has worked. So, it's a cocktail of medication being used. The thing is that you go to the hospital early. I would like to say just one thing. There's one take-home message, is that this condition, you can have happy hypoxia syndrome, meaning you may be very well at home, you may be breathing well, you may have no symptoms, but your lung has opacities inside, and your lung is falling apart. So you need to go to the hospital early when you have symptoms. Maybe if you are building, a lot of these, Delhi government is doing that. I think in your home kit, they are asking you to keep a pulse oximeter, correct? Because if
Dr. Swapna just spoke about, right?
Yeah, so you need to have a pulse oximeter so that you can pick up early. Especially suppose you start having symptoms, you can just walk around for 5 minutes and then test your pulse off, your oxygen saturation, and really help you understand whether you're going into a little more severe phase of the condition.
So what is the reading when it's severe?
So, around 95, if it goes on, walking around, then I would think that you should really go. Below 98, please go, But remember that a lot of the machines that you have in the market are not good ones. So please get the right brand, because a lot of them are not really configured properly.
Okay. Mukesh, I wanted to ask you that, is there anything that besides arsenic al that people can do in terms, like everyone's given us some pointers. Can you give us some pointers homeopathically or even just generally that you feel we could do to alleviate the impact of COVID?
So, Nisha, my message would be this. First of all, the right time to build immunity is when you're well and not when you're sick.
Correct.
And let's understand that. So therefore, the right treatment in homeopathy really is what is called constitutional treatment, where you go to homeopathy, understands your whole physiology, your biology, your psychology, puts it all together,
Okay.
and then find
the right time for people to approach you and start working on the things you're talking about?
I'm saying when you're healthy.
So this is the time we are all healthy.
And when you're well and not when you're sick. So that's my first message, that you need to actually consult your homeopath when you're well and not when you're sick. And, there's something called general immunity. So you need to build general immunity, which is not built in one day. It's built over a period of time. So that's my first point. My second point, of course, is sleep. When I was doing research for my book, I realized that more than 90% of Indians are sleep deprived. So you need to sleep well. You need to eat well. Of course, nutrition, we've already spoken about it. You need to exercise, and you need to have hygiene. Now, hygiene is also personal hygiene, which is physical as well as mental. So while we are talking about cleaning our hands and, all of that is extremely good and we must do it, but are we going to clean our minds as well? And therefore really make sure that you're, mentally balanced, and that, of course, there are homeopathic medicines for that as well, to help you to stay calm and not to overreact. I think these are the 5 points that I'd like to point out as pointers, which can help people at a time like this.
Thank you so much, Dr. Mukesh. So Chetan, do you want to speak a few minutes about Neti Kriya, because you've been doing it every morning, and you shared with me how you're finding it. It's really a game changer in terms of breathing. Am I right?
Yeah. So this is I saw a video from Dr. Kelkar of the Dinanath Hospital sent to me by a friend of mine, and I thought it was a very sort of very involved thing, because like he explained, and he's an oncosurgeon. So he explained that the viruses are, of course, resident in your nasal passages and your cavity. And so we, as dentists and people who are treating that area, is very sort of well-versed with that. So he says that we've been doing this as a part of yoga and Ayurveda for a long time. So let me show you what it is. It's basically just a little Niti Kriya thing, and you put a saline water in there, slightly lukewarm.
So where do you get the Neti Kriya thing?
I got it. And you just put it down your nostril, turn it around, so the saline goes from one part and comes out from the other nostril.
So are you saying to mix salt in it?
You mix salt in it, you get Niti Kriya salt. It's available in all shops, or you can just use common salt. You mix it and you can do this. And this is, I think it made a lot of sense to me, and what the initial reports that are coming out of that hospital suggest, And I haven't spoken to Dr. Gekar. I've tried to get in touch with him, but he was very busy last week. So we should try to talk to him. But he suggested that what he thinks is that the severity of the situation is lessening. From his clinical perspective, it is anecdotal. It is not published so far. So we must understand that.
What do you feel, Suchetan? Do you feel that the impact is a little less at the moment? Are we over the worst?
From what I am seeing around me, I feel that a lot of people are getting infected. It's not that. The good thing is that most of them are asymptomatic. So what we are seeing is that the run on the hospital beds has lessened, at least in my hospital, which I work, which is Hinduja. It is lessened. It is not over. What is going to happen is that the spread is now all over the place. Okay, so we must understand. And one point I wanted to add what Dr. Hegde said also was the new NIH study is saying that please use glasses as well, because that's one of the areas which also could be the transmitted area. So that's the new study. The social distancing norms, and they have done a review of the entire literature. Social distancing norm, they've increased from 1 meter to 2. Now, I don't think that's going to be possible in India, but that's what I wanted to add. What I'm seeing on the ground and treating patients and so on and so forth is that, yes, the asymptomatic cases are a lot, and it's getting a lot into the community. In fact, about 4 or 5 neighbors of mine are already infected, but again, completely asymptomatic. So that's good news. I think eventually we will all be infected. And so we need to be prepared for that. Make sure that your immunity is high, that you're working out, that you're exercising, you're not panicking, you have a pulse oximeter at home, which is going to measure, and make sure that you're in touch with a doctor. That is really, really important. And go to a hospital. Don't wait for symptoms to become severe before you go to the hospital.
I have to interject with one of the viewers actually a few viewers have sent in this question. There is another strain of COVID, which is wilder, while the vaccine that's being created is for the first strain. So does the same vaccine, this question is for Dr. Hegde, Dr. Narayani, and Dr. Suchetan. So does the same vaccine work for various strains of COVID, or as they keep researching, it's going to keep changing its form, and it's going to become a big challenge for humankind?
Let me answer first, since I'm already unmuted.
Absolutely.
I think the most important thing would be to just try it out, because there are some cross vaccinations that can happen, but if it is the mutation is quite severe, then it may not work. So that's another thing. Now, we will have to identify what are the strains which are causing these severe infections. If that's the case, again, we are hearing anecdotal reports from the US. China is also saying that it's gotten, but that could be a political thing, because they're talking about a European import of the virus, mutation of a European, of their virus going to Europe, and then mutating there and coming back to China, and then causing these severe infections. So that could be political, but it's very difficult to say at this point of time without adequate sort of research and clinical trials.
Dr. Narayani, you want to add to that? Yes, Dr. Hegde, carry on.
So Dr. Narayani, she can go ahead if she wants to. Do you want to go ahead, or I should add a point?
Go ahead.
Yeah, so, don't worry about it. Because when, an antiviral drug is very different from a vaccine. When you create a vaccine, you're creating an agent against multiple points on this protein site, right? So you have a surface protein on which the vaccine is acting. It'll act on multiple sites on it. Unlike an antiviral drug, which will act only on one particular, aspect of the mechanism. So there has been a debate in the scientific community, and they have clearly said that it is very too early to worry about the fact that this vaccine may not act against other strains. Also, when we talk about different strains, people have really not gone and actually understood how the strains differ from each other enough, to make that claim that the vaccine under creation right now won't act against them. So not to worry.
What about you, Dr. Narayani?
I just want to add that is there another strain happening?
That will there be a cure and a vaccine? Is it going to be a multi-pronged approach to doing away with the virus?
The aim will be to have a cure and a vaccine, and it'll probably have it'll go in that order. That will be the aim. We'll have to see how effectively it really happens in practice. And is there a more virulent strain happening? Has a strain already mutated? We still need to see data on this comprehensively before we say that there is a new strain. And will the vaccine work or not? I think these are very early to talk about those situations.
Thank you so much. Mickey, I want to ask you, what do you feel, along with the cures and the vaccines, what do you feel could be really important in terms of helping people who are going through the malaise in the middle of the, in the middle of the flu? How can people work at, coming out of it in a better way?
So I think ignorance has to be dealt with. There is so much of ignorance for health, healing, and immunity, and there is so much of chase maze happening around that which drugs will cure it, which mask will you wear, how should you wash your hands, which visors you should use. Move your focus from there into, say, which mudra you should do. Now, there is a study which says that bhamri literally increases nitric oxide in your body. Now, there is also a study which says that different kinds of pranayam, they stimulate and activate area 22 of your brain, your cingulate gyrus of your brain, and everything, all they translate into immunomodulators being activated and your nervous system being activated, and most importantly, your digestion improving. So why not simplify life? Eat pashtik, healthy Indian.
No, I'm talking about, Mickey, in the middle of the pandemic. Somebody's struck down, he's feeling low.
So
There are
start breathing. Start doing anulom vilom, very, very important. Anybody who has started breathing consciously will begin to reverse not only COVID, cancer of grade 4 as well. Because I work with such people. I work with asthma cases.
I'm aware, Mickey, that you visit people who have various
So
malaises.
let me tell you, across the 90 days, I went to the 6th floor COVID ward of Breach Candy Hospital to make a chemo patient breathe, and I made sure he was grade 4. He never got COVID because he was put there as a matter of only prevention or protection. Number two, I went to Tata Memorial Hospital taking a patient every day for radiation, every day. And I was sitting amidst all the patients.
We must clone you.
No. That's perfectly fine. So breathing is very, very powerful, and I do loads of it. Challenging your body in a calibrated way, doing yoga is very, very important because maximum transformation happens there. Flow of your body, rhythm of your heart. The rhythm of your heart synchronizes with the rhythm of the universe, which means your circadian rhythm should synchronize with the rhythm of the universe. So
Thank you so much, Mickey.
Yeah, so wake up in the
That's
morning with the sun.
Yeah.
Sleep every night well enough. Eat vegetarian food only, clean green food.
Dr. Parna wants to jump in. Dr. Parna, please add.
I completely agree with all the points given by our esteemed panelists. I completely understand you have to increase your immunity and all the foods that you've spoken about, and they're really, really important. But one needs to remember that one can fall ill tomorrow, and all these immunity measures take time to act, right? And very importantly, like a mask is very, very important. It's very important to maintain social distancing and go to a hospital early. Do not fall prey to the stigma that ma'am spoke about, because the problem is people are coming to the hospitals too late, right? I mean, now there are beds available in Mumbai, so if you reach a hospital in time, you're going to have a good course. So I really second everything everybody has said.
I want to ask Dr. Narayani and Dr. Hegde that what does a person do when they don't get a hospital bed? I mean, there's been a lot of talks with Chetan about curing yourself at home, having regular paracetamols, hiring an oxygen concentrator, and just riding it at home. So what you're saying actually is a little different to what we've heard. So can you please expand, Dr. Narayani and Dr.
No,
Hedge.
like the panelists have said, keep your basic activities to keep your immunity and all of that going. Yes, nutrition, all of that going. But should you fall sick, you must reach out for medical care and not attempt to treat yourself, and not assume that good immunity and good whatever you've done so far is going to take you through a disease process. So the reach out to a hospital, reach out to a clinician. You get into the category of which state you fall in, mild, moderate, severe symptoms, and accordingly you get treated. You could well be treated from home. You may need hospitalization, just a ward bed, or you may need to go into the ICU. So yes, there is a shortage of beds, but I think coming back to what we originally talked about, there is a good deal of networking which happens. People like Dr. Swapna are playing a very active role in this. And so by and large, with number of hospital beds being available, a lot of other facilities created by the government, people are finding a place to go to. However, by the principal message I'm giving out is you have to be under medical care, under a medical qualified practitioner.
Sapna, are you finding that beds are, yesterday there was a news bulletin that there are more beds and ICU is, have 20% beds available. Is that right?
There was a time when we had a lot of problems getting beds. The bigger issue now is that people come up with choices. Like there'll be someone who would say, I want a bed in Hinduja only. Now that's not possible. That's a big problem. Like you should be able to adjust to any hospital that you get, then it's a possibility. But then there are many people who have these choices and it's really getting difficult to fix them up. Like there are many people who land up at a hospital and say, we would not leave from here until we get a bed here. And it becomes very difficult for the healthcare people to handle that. Sometimes people come up with influential names. Sometimes people come up with this attitude that no matter what, we'll stay in the triage, but not leave from here.
Aparna, you wanted to jump in?
Yeah, so I spoke about the referral system. A referral system is exactly tackles what Dr. Swapna says. When you say referral system, the right patient goes to the right hospital. At a time when you do not have enough number of beds, you cannot have a patient going to Global Hinduja and saying, I'm going to go there when mildly ill and stay there till I get better and go home. Even lay public need to kind of understand they have a responsibility towards ensuring that they occupy the right bed. Correct? If you are if you become positive, take medical help, talk to a doctor. If you're asymptomatic, you can be managed at home, because if you can quarantine at home, that's possible. That's great, because you're occupying a bed that should not be occupied. But when you get symptomatic, under guidance, go to the right hospital. And when you're getting better, suppose you end up in a COVID hospital and you're out of an ICU bed, right? You can go to a DCHC, second level hospital, get transferred there. So that's our responsibility towards other systems, right? So that it works well, right?
So I'm going to start with Dr. Kinita for closing statements. Kinita, tell us that if there's a person in the midst of COVID, what would you recommend? Not immunity, but somebody who's grappling.
I personally believe, like all of them, what they said is keep mental health very strong, because that is one thing that we are genuinely struggling with. And I personally struggle. Like, I think Dr. Swapna mentioned that everybody who is just sneezing or coughing once feels that, they have got the COVID. But my clients tell me that, they've not been feeling well. They feel they're contracting something. And you need to actually stop panicking. You need to stop feeling like you are the only person left to contract this. And even if you do, there is nothing wrong. Go out there, get your help, but maintain mental sanity. I think when the person who's actually got it starts acting all funny, when people around them are the one who collapse, who are actually supposed to be the strength behind them. So, accept it. And we have amazing healthcare professionals who are taking care of this. They're calling out to you all that come to us, show us your symptoms. Don't sit home and cure yourself. So might as well make the most of it. I think it's fantastic what the doctors are doing.
So much to my guardian angel and one of the most beautiful friends I have. Thank you, Kinita. Mickey, you are my other angel. Please tell us all in the world, all your fans and followers, what is your closing comment on this, and what would you like people to, what is the change you'd like in people after such a apocalyptic pandemic, what change should people bring in their lives?
We never grow old. When we stop growing, we become old. Don't stop growing. Don't stop growing. Eat very well, breathe very well, exercise very well. And the good news is that very many doctors, oncos, orthopedics, neurosurgeons I work very close with, these people have started embracing Ayurveda and homeopathy. Dr. Mukesh Batra ji, many people have started embracing homeopathy because I've been pushing people towards Ayurveda and homeopathy. That is the only way forward. Prime ministers of the world have shown us how to wash hands. Modi ji has shown us how to wash our inside through Arogya Setu app. So Arogya Setu is good enough for the COVID Rahu Ketu. So that will take care of that. And please love yourself so much, serve yourself so much that you can serve this universe a lot.
Thank you so much.
Be
Dr.
optimistic.
Mehta, I'm a first-hand, I've been seeing the way you work with senior citizens, with cancer patients. Thank you from the entire world to you for your kindness, philanthropy, and your goodness, your generosity. It's very, very selfless. And like Kinita, Mukesh, Suchetan, y'all are very generous people here. Dr. Hegde, Dr. Narayani, Dr. Anish, who's always advising us all, Dr. Swapna, getting tests done for everyone. Dr. Mukesh, can you tell us your closing statements, and your dear friend and fan, my mother, Shashi Bansal, also wants to know about, if there's any one thing you would recommend in terms of homeopathy, what would it be besides arsenic alb? Your closing statements, Dr. Batra.
Well, I would say arsenic. As far as this epidemic is concerned. Okay, it could change later, but right now that's all I'll say. That's my first message for your mom, whom I love very much. Thank you for supporting homeopathy. Yes. I'd also like to say that we are in the midst of such a pandemic that no system of medicine is complete, and therefore I believe whether it is allopathy or homeopathy or Tirupati, let's take the best of every kind of system of medicine. And having done that, let's make sure that we always, whatever we do under medical advice. I'm saying that's something I always say. I'm saying don't medicate yourself. Don't go into Dr. WhatsApp and Dr. Google and take advice from there. Please consult a professional person. It can save your life and it can make people around you very happy.
Thank you so much. Dr. Anish Gupta, thank you for being such a loyal, person, such a stalwart in our group, always giving advice. So you've always been so generous with your advice to the COVID groups that we are running. Can you tell us your closing statements? What do you feel that people should do? What is the message they should leave this panel with? Dr. Anish, you're muted, unfortunately. May I request you to unmute?
Yes. To me, COVID is a mind game. It is playing with our minds. The main mantra is "Dar ke aage jeet hai." So be strong. There is no worry with COVID. Be strong and take your daily diet regularly, daily exercise regularly. Nothing will happen. You will come out with this.
Thank you so much, Dr. Anish. That's very kind of you. Dr. Narayani, thank you for leaving you're not only treating patients. Dr. Narayani is working on the floor. She's a COVID warrior. I must thank you for making this time and coming on board, helping so many people gain confidence and going away from this panel with a certain degree of positivity. Dr. Narayani, what are your closing comments for all of us here today?
Don't panic, be logical, stay safe, and reach out for help at the earliest hour you feel unwell.
Thank you so much, Dr. Narayani. Really much obliged to you. Sapna, can I ask you for your closing comments, please?
Yeah, my closing comments would be trust doctors and take advice from medical professionals only. And also one more advice is please be careful about all the disposables. The gloves and the masks that you use, please dispose them rightly.
Thank you, Swapna. That's a lovely piece of advice. Dr. Hegde, I not only want you to give us your closing comments, but a quick word about pregnant women who have COVID. I've been wanting to ask you this all along. Would you be so kind as to tell all your fans and followers, is it a good time to get pregnant?
So the closing comments, of course, wear a mask, wear a mask, wear a mask, and wear a mask over your nose and your mouth. Very important. Too many people have their mask on their throats, correct? Very important. Do not wear a mask with an exhaust wall. Do not wear a mask which is a sieve-like or honeycombed when you're using fabric. Very important. Too many of them are wearing that. Maintain social distancing. Remember that you need 20 minutes of exposure to somebody who's coughing or sneezing to get the virus. So the virus is transmissible, but not so much that if you just walk by somebody, you're going to get it, correct? So please understand that. So asymptomatics you're going to meet, but you're not going to get it from them if you're wearing a mask, right? So the very important thing is don't touch the outside of the mask. That dispose them off very well, but also don't touch the outside of the mask. There is a way of removing your mask. When you go outside and come back home, there are enough videos on YouTube. Please take the mask out with your ear loops. Do not touch the outside. You know, we tend to do this, right? We keep putting it up this way and we keep taking it out. Don't do that. Once you wear a mask, please take it out only through your ear loops. Very important, right? Now, pregnant women. So in addition to being a urogynecologist, I'm also this founder of this NGO called Arman that works in the field of maternal and child health. And as a part of that, we have a virtual OPD. So what had happened in the COVID situation is that too many of the hospitals had closed down. Also, many hospitals were doing only COVID work. Now, pregnancy and infancy are real time. They don't wait for a pandemic. They don't wait for a lockdown. You have to get care immediately. If you need an ultrasound, you need immediate ultrasound. If you have a risk factor, you have to go to hospital early. So our virtual OPD, in fact, I would like to give the number to everybody because we get calls even from middle class women who are pregnant or have children.
I'm going to post this on YouTube.
Yes.
So I want all you doctors to write your comments under the YouTube because the whole world visits it. So yes. The YouTube channel is Nisha Jamvwal. And doctor, I want you to post the number there, please.
Okay. So I'll just tell you 1-800-2121-425. So the antenatal OPD, virtual OPD is from 11 a.m. to 3 p.m. And from 3 p.m. to 7 p.m. is the pediatric OPD. And it's
so much, Dr. Aparna. And we are running out of time. It's going to close automatically. But before that, somebody who's been instrumental in putting this together with me, I cannot end without his closing comments and without showing a lot of gratitude to him. My dear friend, in fact, my best friend, Suchetan Pradhan. Dr. Pradhan has not only been a force in, this panel, but also in my life. And I would like to invite Dr. Suchetan Pradhan to give his closing comments. Besides thanking him, Dr. Mayuri, Abhishek and Preeti and Radhika, my old friend, for helping me put this together. Thank you so much. And all of you, Kinita, who's been, an angel in my life, Mickey, whose family, not only for me, but my mother and father who adore Mickey Mehta, Dr. Hegde, who might be a new entrant, but Dr. Hegde, you're going to stay with me forever, I'm quite sure. Mukesh, who my entire family is in love with, thank you for being here with us. Dr. Narayani, thank you so much. You are so practical and you touched everyone's heart by speaking about not stigmatizing COVID. Dr. Swapna, who's friend, family, and very, very close to my heart. I truly do love her. Anish, I've already said that not only are you helping the Ayush Ministry, but all of us in the world with your generosity. And Suchetan, may I request you to give closing comments and the thank you note also?
Yes, first of all, let me say that COVID is here to stay and we need to work on this. So my first message, I've got two small messages. First is to all the doctors who are not working and who don't have comorbidities and are sitting at home because of fear. Please come out and help us working on the field. It's very important. The young people who will have less symptoms, who will have milder COVID, we have a problem in hospitals today because we do not have enough adequate doctors attending. We've had so many people who have gone into quarantine for 14 days and then there is a lacuna. So please, 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 that's my first message. My second message is reiterating what Dr. Hegde said. Please wear a mask. Make sure that the other person is wearing a mask. Keep social distancing. Wear your glasses And if you're traveling on a flight, wear a shield. Make sure that you understand that this is not just a fomite contact, it's also airborne transmission, whatever the WHO had said at any given time. We know today it is happening from even the toilets and the loos that we are using. And lastly, let me thank my dearest friend, Nisha Jamvwal, for having done an amazing job with COVID. She runs these 2 WhatsApp groups, and I see so much information and correct information being passed, because it's important to understand that information can be true, and information can be scary, and information can be false. And there is importance to sift out what is true and what is false. So again, let me thank her for having organized this. And I'm sure I'm saying this for all the participants on the group. Thank you very much, Nish.
Thank you so much, Suchu. Thank you so much, all of you.
Thank you, Nisha. Thank you so much.
Thank you.
And thanks to all the participants. So you've been amazing. You've been absolutely amazing.
Thank you.
Thank you so much.
Thank you.
Thank you.
Thank you.
Thank you, and a big hand to all of you.
To all the doctors who spent their valuable time and come, and to others who have, everybody's a doctor here. I can't say anybody who isn't except Nish, and we want to make you a doctor because now your information is, we'll give you a doctorate anyways. Right?
Thank you, Suchetan. If it's coming from you, I accept it with lots of gratitude and love.
And say hello to Jamie from me anyways.
Yes.
Right.
And I thank all the viewers here with us today. Thank you so much for, always pushing me to do this. And it's because of you that I've got such a fabulous panel, and everyone's come through so beautifully. Thank you so much.
Thank you.
Thank you.